Menopause can be devastating. I've talked with over 3,000 women in menopause, and they've told me stories that literally brought me to tears sometimes. Maybe you can relate to some of their stories. Sleeping 2 or 3 hours every single night for months or even years. Extreme anxiety that makes it nearly impossible to walk out to the mailbox, take out the trash, or even drive to the grocery store. Depression so severe that you may have seriously considered, is it really worth going on one more day? Hot flashes that come out of nowhere in the middle of an important meeting at work, pouring embarrassment and humiliation on top of buckets of sweat. Night sweats, waking you up from those rare moments of sleep, soaking your night clothes and forcing you to get up and change. Well, then you start shivering and it's nearly impossible to get back to sleep. Maybe you've never had trouble losing weight before until you went into menopause. And then no matter how intensely or how often you exercise or how you eat like a bird, you just can't seem to shake that extra weight. Then there's vaginal dryness and painful intimacy, the loss of sex drive, all of which affect your relationship. Well, I don't know your husband, but I wasn't all that understanding when that started happening with my wife. For over 20 years, women have been misled, misunderstood, and flat out lied to about menopause and, more importantly, what you can do about it. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those resources are about hormones and hormone optimization. If you'll do me a favor and click the like and subscribe buttons, you can follow my channel. I've got tons of videos that help you learn the truth about menopause, as well as the safest, most effective treatments for all your menopause symptoms. If you click that little bell, you'll get notified anytime I post a new video. Well, in the New York Times Magazine from Sunday, February 5th, 2023, reporter Susan Dominus says, "We've been misled about menopause." In his landmark book, Estrogen Matters, Dr. Avram Blooming details the menopause lies that women have been force-fed over 2 decades. Healthcare influencer and physician Dr. Peter Attia, author of Outlive, The Science and Art of Longevity, calls the handling of hormones and menopause hands down the biggest screw-up in the medical field in the last 25 years. Well, the 2 biggest lies about menopause boil down to these. Number 1, menopause is just about the symptoms. And number 2, there's nothing we can do for you. Let's give your family doctor, your gynecologist, your primary care physician the benefit of the doubt. It's not their fault. They haven't gotten the most complete and up-to-date information. They haven't even had very much training in menopause or what can be done to treat menopause symptoms. Well, I just took a look at a study that said that 20.3% of residents in family medicine, they just graduated from medical school, had 0 menopause lectures. Less than 7% of those residents felt adequately prepared to manage menopause. Another study of OBGYN residents focused on women's health, 67% of those residents said they didn't adequately understand hormone replacement therapy. 67%. Uninformed healthcare providers continue to tell women things like, hormones increase your risk for breast cancer. Estrogen increases your risk for blood clots, heart attack, and stroke. Progesterone's only necessary if you still have your uterus and haven't had a hysterectomy. You should only take hormones at the lowest possible dose for the shortest possible length of time. Hormone replacement therapy should really only be used to treat hot flashes, and those hot flashes are going to go away. You'll just have to wait them out. Since HRT is so risky, you should take an antidepressant like Zoloft or Prozac instead. Ignorance on the part of well-meaning providers leads to devastation for women in menopause. They email me and make comments on my videos every single day. Because the vast majority of healthcare providers don't adequately understand menopause and hormones, they're constantly perpetuating these 2 things. Number 1, menopause is all about the symptoms, and number 2, there's nothing we can do about it. The problem in menopause, the root problem, isn't the symptoms. As devastating as all those symptoms and many others can be, the problem in menopause isn't the hot flashes. It's not the night sweats. It's not the weight gain. Menopause is not about vaginal dryness or painful intimacy or the loss of sex drive. It's not even about insomnia, mood swings, depression, anxiety. Don't get me wrong, menopause symptoms are awful. I obviously don't know this from personal experience, but the stories women have told me just break my heart. The real problem in menopause, the root problem, is the loss of your hormones. I'm talking specifically about the loss of estradiol and progesterone, testosterone as well, along with some other hormones. Those hormones basically started out at 0 when you're born. Then they jumped pretty high when you went into puberty at age 12 or so. They stayed high for the next 40 years in most women, and then they dropped back to 0 or close to 0. If you still had those hormones, those symptoms would have never started in the first place. Sure, there are treatments that can reduce hot flashes or help you sleep, maybe even help you lose some weight. But unless you address the root problem, which is the loss of your hormones, you'll never really be able to feel like yourself again, free from all those menopause symptoms. Even worse than the symptoms, though, is the fact that the loss of estradiol, progesterone, and those other hormones leads to a list of health problems as long as your arm. Low hormone levels, like what you get after menopause, are at the root of serious health issues like heart attacks, strokes, other forms of cardiovascular disease, osteoporosis, broken hips, nursing homes, Alzheimer's disease, insulin resistance, and type 2 diabetes. Those are risks for heart disease in and of themselves. If we fix the loss of estradiol, progesterone, and the other hormones, we can have a dramatic positive impact on your health risks. Well, I like to emphasize two things about what I call optimal hormone levels. Those are hormones that aren't too high and they're not too low, but they're just right. When you get just right hormone levels, you can reduce or even eliminate those menopause symptoms. You can also reduce your long-term health risks at the same time. Well, in spite of what your sadly misinformed doctor may have told you, there is something you can do to treat those menopause symptoms. There is something that can help you feel like yourself again. There is a safe, effective treatment for menopause that takes care of the root problem. The root problem is the loss of your hormones. So how can you get that safe, effective treatment for menopause? Who exactly has the training and the experience and, more importantly, just the willingness to optimize your hormones so that you can eliminate your awful menopause symptoms and reduce your long-term health risks? Well, that person might be your primary care provider, your OBGYN, your family practice provider. As we've already talked about, the vast majority of providers just haven't had the training to feel comfortable treating menopause. It's not their fault. Well, here are my suggestions for your first 2 steps. Step 1 is to make your HRT decision in about 2 hours. I've mentioned that optimizing your hormones is the only real solution to the root problem in menopause, the loss of hormones. But I've given you just the most basic introduction to the Menopause Solution. I'm sure that you have lots more questions, fears, concerns, confusions. Don't feel bad about that. Every woman in menopause that I talk with has similar hesitations. To address those hesitations and confusions, I've created a digital course. It's called the Menopause Solution. This course helps you clear up all those things and make your decision about whether hormone replacement therapy is right for your menopause or not. It takes about 2 hours to watch the short, simple videos in the course and make that decision. One of the resources that's included in the course is a way to take step number 2. Step 2 is to ask. I've created a simple 1-page document called the HRT Questions Framework. You can print out this HRT Questions Framework and take it to your doctor's office. Ask your primary care doctor, your family doctor, your OBGYN some specific open-ended questions to find out if he or she is knowledgeable and comfortable about hormone optimization. You can start the conversation with your healthcare provider about hormones and menopause. As I mentioned, the questions are open-ended. They're not leading or trying to trick anybody. They're designed to be non-confrontive. Your doctor's on your side, so let's start with that assumption and not put them on the defensive. The answers your doctor gives you can help you determine your next steps. If your doctor seems capable of helping you with a real menopause solution, one that addresses optimizing your hormones, then find out what they'd recommend in your situation. If their answers indicate your provider is unable or unwilling to help you, I might be able to help you find somebody else, but let's not get ahead of ourselves right now. If you aren't ready to take the Menopause Solution course and make your HRT decision, that's okay. You can simply request the HRT questions framework, and I'll send it to you at no cost. You'll also get some emails from me that tell you more about the course and about the possibility of finding a hormone specialist if you decide you need one. Thanks so much for watching, and I'll look forward to hearing from you inside the Menopause Solution. Let's get this sorted out for you.